Well, the numbers are staggering, and we have yet to see the worst in regard to coronavirus. So how much more can our hospitals handle? CBS 2's Dhillon is live at Jacobi with the very latest. Kiran, good morning.
Good morning, Mary. Yeah, the nurses here at Jacobi Medical Center just held a press conference. They say the hospital is putting their lives at risk by asking them to reuse their personal protective equipment. Nurses on the front lines of the coronavirus crisis at Jacobi Medical Center in the Bronx are fed up. They say after the CDC changed its guidelines, they were told by management to reuse their personal protective equipment, including N95 masks, for 1 week. It's just one of many stories coming to light from healthcare workers across the tri-state.
The masks are supposed to be one-time use. Prior to coronavirus, they were one-time use. You use them for a patient and they went in the garbage. And now all of a sudden the CDC is saying that it's fine for us to reuse them, and these choices are being made not based on science, they're being based on need.
These images taken inside Holy Name Medical Center in Teaneck, New Jersey, provided to us by the hospital, give us an inside look at how they're battling the coronavirus. Doctors and nurses suited up. In some of these pictures taken by Jeff Road, we can see the faces, or at least the eyes, of the people fighting this head on. Many healthcare workers in New Jersey are now sick themselves. Friday, a plea for help for volunteers.
If you have medical experience and wish to pitch in to help us get through this emergency, please sign up.
What's even more alarming is knowing how many of my colleagues are home sick.
Dr. Stavros Christoudias is a general surgeon who works at several hospitals, including Holy Name. He says New Jersey doctors are of particular concern. According to the Association of American Medical Colleges, New Jersey ranks third for active physicians age 60 or older.
What horrifies me about our doctor workforce is that we're the oldest in the country by a lot, not a little bit, by a lot. The doctors who are going to work are very vulnerable.
As someone who performs emergency surgeries, he has another concern. He's worried about people who stay home to avoid the ER.
What about the guy who never made it in and just stayed, suffered at home with an appendix for 5 days? That can be fatal.
And over to New York, where construction on the 4 temporary hospitals at the Javits Center is now complete. Governor Cuomo toured it on Friday. He's also asking for the authorization from the president to construct 4 more temporary hospitals in addition to the 4 sites already selected. One could potentially be located at the New York Expo Center in the Bronx, the rest in the 3 other boroughs.
One in Queens at the Aqueduct Racetrack site, 100,000 square feet there. One in Brooklyn, what's called the Brooklyn Cruise Terminal. It's owned by the Port Authority, but it's a wide open space, 182,000 square feet. And in Staten Island, the College of Staten Island.
So as for the complaint by the nurses here at Jacobi Medical Center, we have reached out to the CDC as well as the city. We are awaiting those responses. We're live in the Morris Park section of the Bronx. Kiran, Dhillon, CBS 2 News.